I was worried about Brian for a long time before he told me he was sick. When we'd go out to restaurants, he would only eat a few bites of his food. His beer would remain mostly full, and by the end of the meal, he'd be offering it to me, asking if I wanted to finish it. Clothes started hanging off of him, and his complexion became pale and deflated, cheekbones sticking out at the sides of his usually rounded and rosy face. I'll admit I was afraid to question him about it. Chicken shit that I am, it took me months to say anything. Although I used the excuse later on that the change had been gradual and difficult to notice at first. "How are you doing, man?" I had asked him one day, sitting in his apartment. He gave a shrug and a non-committal, "All right." But I looked him in the eyes and pressed him for an answer. "I mean, how are you really doing? Have you been to the doctor?" By this point, he couldn't play dumb. He had lost a lot of weight by then. He had just returned from the bathroom where the sounds of retching could be plainly heard through the door. Sighing, he looked at me with eyes that gave no indication of emotion, sadness or otherwise. "It's stage 4. The big C." The shock I felt hearing it out loud surprised me. It wasn't real to me for several more days, maybe even longer. Still, I comforted him as best as I could. There's nothing good you can really say in these types of situations, but I tried anyway. I brought him his favorite meals after that, going to see him pretty much every day. He said they gave him 3 months, maybe less. He didn't have the energy to do most of the things he had enjoyed before getting sick. Still, we went out and did a few things that he was feeling up to. We played pool and went to the movies, went bowling and to an arcade. Nothing I did seemed to cheer the poor guy up. Finally, I asked him a question that had been on my mind. I had seen an ad for the Make-A-Wish Foundation, and thought it would be great if I could do something even remotely close to that for him. "If you could have one wish, what would it be?" I asked him, sitting at his dining room table one night eating his favorite Chinese takeout. He was picking at the food on his plate and barely touching it. His face actually perked up for a minute. Brian smiled for the first time since I'd seen him getting sick. But then his face dropped again and he looked even sadder than before. He shook his head. It wouldn't work. I couldn't ask that of you." "Ask what? Come on, just tell me. If I can do it for you, I will." Still, he hesitated, looking squeamish and uncomfortable. "Come on, Brian. We've been friends since elementary school. What the hell is it? Now I just need to know out of curiosity." "No, I can't. You'd think I was nuts. You'd never look at me the same way." He must have seen the confused way I was looking at him, and he said quickly, "No, it's not that." I assured him that whatever it was, I would think no less of him. On top of that, I said I would agree to it, especially if it was so important to him. We were best friends, after all. Like brothers. "You promise?" "I promise." "Okay, just close your eyes for a second." I was growing more and more perplexed, but said, "Sure," and did as he asked. The instant my eyes closed, I felt a rush of air as he came at me, and wrapped his hands around my throat, beginning to strangle me violently. My eyes shot open. I looked to see him standing over me, tall and gaunt, smile brimming from ear to ear. I had never seen him look so happy. "Oh man, thank you so much. I've always wanted to do this to somebody. Thank you." His grin widened further, and he began to laugh as the world went red around the edges. I tried to ask him to stop, but no words came out, only a wet, strangled sound. There was a mirror nearby, and I could see my face in it. I could see by my reflection that I was starting to turn darker shades of red, then purple. My eyes were bulging and veins were popping out. My mouth was opening and closing like a fish out of water. My hands tried to pry him away from my throat, but he had always been the stronger of the two of us. He was substantially larger than me. This feels so good. He was actually dancing now, jumping back and forth from foot to foot like a kid too excited to contain himself. Why have I never tried this before? This is better than anything. And man, I wish you could try this. But you probably wouldn't be into it. I shook my hand back and forth, and the blackness clouded my vision, and I began to slide out of my chair, my body going limp. My head landed hard against the floor, and I vaguely remember feeling the relief of being able to breathe again, and being happy about that, before falling into unconsciousness. I woke up with my hands duct taped behind my back, and a piece of it covering my mouth. Brian was standing over me a moment later. "Oh man, you woke up. Phew, you were looking pretty rough for a while there. Listen, I could tell you were pretty mad, and sure, yeah, I guess I would be too. So I'm kinda worried you're gonna call the police now." "Mm-mm." My voice came out muffled through the duct tape which covered it. "Yeah, so I was thinking, we're best friends, like you said. And you told me you'd still be my best friend no matter what, right?" I nodded my head weakly, looking up at him and feeling like I was falling down a dark hole. "Right, so I'm just gonna keep you here for a while, so we can hang out some more. Just for a few more days. Weeks? We'll play it by ear. I really don't want to spend my last few weeks on the planet in jail. You get it. And I'm kind of worried that that's where I'll end up if I let you go." Shaking my head back and forth rapidly, I pleaded with my eyes for him to let me go. He didn't. The following weeks were a lesson in pain and patience. It turned out, after all these years, I had not known Brian very well after all. I thought we had no secrets from each other. But I discovered that some folks have urges so dark that they usually take them to their graves. Unless, of course, their best friend pries them out with a metaphorical crowbar, as I had done with Brian. I had practically begged him to play out his dark and horrifying fantasy. And once it was done, he discovered that he needed that rush again. He went out and brought home more victims, who were not so lucky. Homeless folks and street workers, I discovered later on. By the time the police found me, following his confession, he was already dead in the hospital. He never served any jail time for what he did to me or any of those other innocent people. I have bruising and scarring around my neck that will be discolored for the rest of my life, according to doctors. Therapists tell me to let it go. I've been to several of them. I have trust issues now. Go figure. Am I mad at him? Yes, of course I am. But the anger will fade over time, I'm sure. I could never stay mad at that guy. Hey guys, story number 2 is a fun one today. It's one of my favorites and it'll be coming up in just a second. If you're enjoying today's video, I hope you'll subscribe, leave a quick comment below. I was just looking the other day and saw that almost half the people who watch the channel aren't subscribed, so please, if you enjoy my videos, I hope you'll take a quick second just to hit that subscribe button. Okay, now on to our second story. The nurse sitting across from me was looking inside the binder, confused. She flipped through one page after another, sifting through progress notes and orders. Around us were the sounds of a dozen other voices speaking at the same time, discussing patients and their care plans, bed movements and medications, physiotherapy and discharge follow-ups. Let's see, I just met him this morning, she said. I wish I could be of more help, but like I said, he's a John Doe, so we don't know much about him. Here it is. Maybe this will give us something. There was a hastily scrawled progress note from the day of admission. It read, "Integumentary. Midline abdo-lateral incision appears to be infected. Wound covered with newspaper? ? On admission per triage. +++ purulent discharge noted. Erythema. Foul smell. Possibly old pericardial incision, but no sternal or femoral sites found. Will order wound care to assess and follow." That's it? I guess so. It's been really busy lately, though. They probably didn't have a lot of time. There were other notes as well, but nothing concerning the wound. Alright, I guess I'll just have to take a look at the thing for myself, I said, standing up. Is he with it? That's hospital code for, is he gonna hit me? Or scream bloody murder when I rip the bandage off? Is he confused, or is he with it? She hesitated. No, not with it, I wouldn't say. But then it's really hard to tell. He doesn't say anything. And if you try to look him in the eyes, he just looks right through you. Sounds like he's probably confused. Maybe nonverbal? Yeah, I would have thought so too. But there's something about him. You know how they can say that intelligence is in the eyes? Well, when I look him in the eyes, or try to, it's like there's some... She stopped and looked embarrassed. Somewhat. This is gonna sound stupid. I should probably just stop talking. There were people all around, but nobody was listening. The other nurses and doctors had other topics on their minds, and were all engaged in other matters. What is it? I asked, curious now. Her face softened, and she opened up and told me. It's like when you look him in the eyes, there's somebody really wise looking back at you. Somebody way smarter than me. It's almost like he doesn't want to look at you because he's off somewhere else in his mind. Or like he doesn't think we're worth his time. Like I said, this probably sounds really stupid. Not at all, I said back to her, thinking I would have to go and see for myself. Do you want me to come with you? She asked. It's okay, you're busy. Go ahead, deal with your other patients. If you hear me calling for you, just come give me a hand, okay? For sure, she said, and quickly ran off to deal with other matters. Call bells were ringing constantly, and around every corner someone was quickly coming with a tray of food or a stretcher, a cleaning cart or a medication cup in hand. I made my way through the semi-organized chaos and walked down the hallway towards room 14. It was the furthest room from the nursing station, and as I walked past a few others, I heard patients inside calling out, screaming, wailing in pain and terror of invisible enemies. I stopped once or twice and looked in to see nurses were already engaged in helping some of them, while other staff members put on bright yellow isolation gowns and gloves and prepared to enter different rooms. The powerful odor of infection wafted out of room 14 as I approached. I doused myself with hand sanitizer like a priest with holy water at the threshold, and quickly gowned and gloved, walking into the room and into the thick of it. As I entered room 14, I saw a man laying in bed. He was staring at the ceiling, and did not acknowledge me when I said my greetings. Hello, sir. My name's Jerome. I'm a wound care nurse. I'm here to take a look at your dressing. I hear you got a bit of a hole in your abdomen there, and the doctors would like me to see what I can do to help. Is that okay with you? He did not say anything. I stepped forward and stood at the side of the bed. Pushing the button on the side rail, I made the whole thing go up, raising it to waist height to preserve my back. I'm just going to pull back the sheets and take a look here, okay? Again, he said nothing. I pulled down the bed sheets and pulled up his hospital gown, revealing a hairy chest and abdomen with a patchwork of bandages covering his stomach. Slowly, I began to pull them away one by one. I watched his face closely, ready to back away at any signs of anger or agitation. A pericardial incision is typically made during a CABG, coronary artery bypass graft, procedure, more commonly known as open heart surgery, but it is one of several large cuts made during the procedure. The sternum will have a large vertical incision at the midline of the chest. There will also be incisions made in one or both legs, depending on the quantity of saphenous vein being harvested for the procedure. This is all important for the simple reason that Mr. John Doe had none of these scars. No wounds from any other surgical incisions. And yet there was this long lateral scar on his abdomen, isolated and alone. No other wounds anywhere. The man appeared malnourished and thin, like he hadn't eaten anything in a very long time. The nurse had said he was refusing to eat, and the next step was to insert a nasogastric tube later that day. Looking at the wound, I saw it was macerated and red, wet and white in places, pruny like fingers after being in the bath for too long. There was an odor coming from it, a rank and putrescent stink like death and infection. My job could be interesting and rewarding some days, but this was shaping up to be a hell of a morning. Of course, I had no idea. Not yet. The smell only became worse as I began my work. I cleansed the wound with a massive amount of saline and watched as yellow pus seeped out in vast quantities. Once it began to run clear, I dried it with gauze as best as I could. The whole time, the man just stared at the ceiling, looking like he was far superior to all of this, like none of it was important. I quickly cleansed my hands with hand sanitizer, then laid out my sterile field. I set out my fresh sterile gloves and opened my dressing tray and my packing gauze. Also, I took a swab out so I could measure the depth of the hole. After putting on my sterile gloves, I plunged the swab into the wound and began to explore it from multiple angles, trying to determine its size. Width, depth, height was all that was needed, and then I could start to pack it. All the while, it seeped and stank. The wound edges seemed to move and twitch as I worked, as if it was a mouth and I was a dentist poking around inside. But that was silly, I thought to myself. That was just the visor fogging up, distorting my vision, of course. I managed to measure its width and height, but couldn't determine the depth. The whole while I was observing the patient's face, and seeing he didn't flinch or grimace with any of my prodding. I was thankful he wasn't swinging at me at least, as some others did. Next was the final part of everything. I just had to pack the wound and cover it with a dry dressing. Then I could finally get away from the smell of that room. Deciding it would take far too long with tweezers, I simply changed my sterile gloves and used my fingers to pack the hole in the man's abdomen. I lightly began to fill the wound, starting at the outside edges. As my hand went into the center of it, I began to feel something pulling hard on my finger, like one of those finger trap toys I had played with as a kid. The sensation was so unusual and bizarre given the circumstance that I was completely shocked, and couldn't even open my mouth to scream. I just tried to wrench my hand away desperately. The thing inside the man's abdomen held fast. That was when something sharp started to slice into my finger, and that was enough to bring me back to reality, and I remembered then I could call for help. I let out a howling scream, wailing at the top of my lungs in horror and pain. Looking at the man's face, I saw he was no longer catatonic. He was staring straight at me now, his blue eyes shining with satisfied intelligence. He appeared to me suddenly like a man who has not eaten for a very long time, who was finally getting a meal. My screams rang out in the room, but I realized with dawning horror that the other confused patients in the room surrounding this one were also screaming loudly, probably drowning out my calls for help. As my eyes darted around the room for something to help the situation, I felt my hand getting sucked in like a ramen noodle being slurped up by a greedy mouth. Sharp teeth dug into the flesh of my fingers at the same time, and then were up to my knuckles, then my palm. I reached over with my other hand and tried to pull on my wrist, trying to yank it free. It hurt more than anything I had ever felt in my life, as I pulled against the razor-sharp teeth and they ripped through my flesh. The man's face now looked smug and self-satisfied, and I felt his stomach mouth pull me in deeper, now ingesting my hand nearly up to the wrist. I pulled my other hand away as it tried to suck that one in too. The whole time I continued to scream and scream, now using my foot as leverage against the bed frame, doing anything I could to get it out, to get it away. It felt like fire in my hand, burning me up to my wrist. The pain was so severe I felt like I would black out, but managed to stay conscious as I fought and pulled against the strength of this horrifying alien creature. I glanced again at the man's face, and saw his tongue look black inside his mouth, his teeth yellowed and missing in places. He began to laugh, but the sound did not come from his face. Just as the world began to go red and then black around the edges, I heard a sound from behind me of someone entering the room. My wrist was freed as if the giant mouth had merely opened up and released it. I fell backwards against the wall, my forearm a bleeding stump that I held up and looked at dumbly. The nurses who entered the room said later that they didn't see the man smiling, or hear him laughing as they entered. He looked catatonic as always. What they did see was a hysterical nurse on the floor, weeping and screaming and missing a hand, a trail of blood leading to the bedside, and to a hole in the man's abdomen. A very unusual wound that was now turned up at the edges, like a satisfied smile. Become a channel member today for early access, bonus videos, and special emojis only available to members. Check out the description below or click the join button for more info. If you'd like another way to help support the channel, please consider joining my Patreon page at patreon.com/JordanGroupeHorror. As a patron, you'll get access to bonus videos and content. You'll be credited at the end of every video going forward. And if you decide to stay for 3 months, I'll name a character after you, which will be featured in a Hollow's End story. Links to join the Patreon are in the description. Thanks everyone for listening. Please like, subscribe, and comment to help the channel continue to grow. And see you again next time at 4 p.m. Eastern Standard Time. Hope you have a great night.